Okay. All right. Yeah. Good morning, everyone. Thank you for coming. For those at home viewing, thank you for tuning in. My name is Trung. I'm a physical therapist here at. Is it on? No? Can you hear me now? Yes? Okay. Uh, well, good morning again. And my name is Trung. I'm the physical therapist here at John Knox Village. You'll find me at Oak Park at the outpatient clinic there. And today we're going to talk about balance and how a balance system works. So my last talk, we talked about fall prevention. So you want to review your medications, have your vision checked, make some home modifications if needed be, and also participate in an exercise program to help prevent falls. And so today I want to talk about balance, and to follow up on that, fall prevention strategies is to define what balance is and the types of balance systems that you have. We'll also talk about age-related and abnormal balance patterns, and then learn about different types of balance testing. So what is balance? Balance is the ability to maintain your center of mass over your base of support. A properly functioning balance system allows humans to see clearly while moving, identify orientation with respect to gravity, determine direction and speed of movement, and make automatic postural adjustments to maintain posture and stability in various conditions and activities. Center of mass is defined as your average location of all your mass within your body. And your base of support is the area underneath that person that includes every point of contact that is made with the ground. So you can see, okay, good, my laser pointer is working. So the center of mass is located here, about 10 centimeters below your belly button. And here with the person's feet wide apart here, that creates their base of support. So the center of mass depends on the gender and position of the limbs. And you can see where it's still located, again, right below your belly button, whether you're standing, running, or kicking. So again, to maintain your balance, you want to have good base of support, and using a cane or walker can widen your base of support. You can see this individual here using the cane. That base of support not only includes his feet, but where the cane is making contact with the ground. And this person here using a walker is having a much wider base of support because of the four legs of the walker. And as I had mentioned in the previous presentation, how sometimes when I've suggested using a walker or cane to someone, their automatic response is, oh, it makes me look too old, or it's too cumbersome to carry around. But of course, it's for your safety, because as you can see, with a wider base of support, it's easier to maneuver your center of mass to keep yourself more stable and balanced, and continue to keep you independent with walking and moving. Center of gravity, this is the imaginary balance point where the weight of your body is concentrated and equally distributed. Also, it's the point from which the object will remain balanced. So in anatomical position, that center of gravity is positioned right in front of your second sacral vertebra. However, as humans, we're not always in a fixed position. We're always constantly moving. So the precise location of the center of gravity will change with that new position that you make. So you can see with this person here bending backwards, the center of gravity shifted back a little bit just to still remain over where his feet is, over his base of support. And then this individual bending forward, moving hips backwards, the center of gravity has moved outside of his body, but it's still over his feet, where his base of support is, so he can stay balanced. So you see the list here of types of balance, starting with the static balance or steady state balance. That's the ability to maintain posture stability and orientation on a level surface or at rest, so that's either in sitting or standing. Your reactive balance, that's recovering from an unexpected perturbation. So if you were nudged by someone slightly, your reactive balance will kick in to keep yourself upright. Proactive balance or anticipatory balance is activating your balance in advance. So for example, you're going to the refrigerator, you're going to pull on that refrigerator door, you need a little bit of force to open the door, and then you're going to reach for that milk carton, which happens to be all the way in the back, so you know that by leaning and reaching forward for it while maintaining your balance. So it's anticipating that you need to move your center of gravity forward and to keep yourself upright. Dynamic balance, that means maintaining your balance while moving. Did I lose my screen here? Oh. Okay. Dynamic balance is your ability to maintain your balance when you're in movement. So balance it's a complex system. It's comprised of your sensory system, motor system, and your cognition. I'm going to go over each category in detail, focusing more on the sensory systems. Sensory systems can be broken down into two parts. You have your peripheral input. This is comprised of your visual system, somatosensory system, and your vestibular system. All of these systems provide input regarding your body's equilibrium and will help maintain your balance. And I will go over each of those categories in detail in the next few slides. The other part is central processing. So after all these three systems have received that information, it will bring it to the central processing area. So that will interpret that information and then send commands to the motor systems. So the central processing is comprised of your cerebral cortex, or your brain, your cerebellum, and your brainstem. Your cerebral cortex will help with higher level thinking and memory. Your cerebellum regulates posture and deals with coordination. And your brainstem integrates and sorts the sensory information. So this is a picture of your brain. It's comprised of 4 lobes. The frontal lobe is typically associated with higher level functioning, reasoning, some problem solving, and as well as emotions. The primary motor cortex, which is located in the back of the rear end of the frontal lobe, that receives information from other parts of the brain and will ensure that movements of the body is carried out. The occipital lobe, that's found in the back of the brain, and that's primarily responsible for processing visual information. So it's receiving information from the retina, and then it will interpret that information for use. Your parietal lobe, located on top, is responsible for perception of various stimuli, orientation, movement. It's home of the somatosensory cortex, which is located here in the front. And that enables the body senses to be processed. The temporal lobe here is receiving auditory information. It's also associated with speech and memory. That's where the hippocampus is located as well, which handles memories. Damage to this area will lead to deficits in memory problems and language deficiencies as well. And down here, that's where the cerebellum is located. That's handling posture and balance. It plays a key role in carrying out voluntary movements. Most of those movements are results of different muscle groups acting together. So the cerebellum helps coordinate those movements, make sure those movements of the different muscles work together. And the brainstem, that's like a relay station. So relay signals coming from the brain and cerebellum, let's bring it down to the spinal cord, and that will handle also involuntary things like sneezing, coughing, breathing, swallowing. So now I'm going to talk about those three sensory systems, starting with the visual system. So you can see with the eye here, the light passes through the pupil, and it'll go back to where the retina is. And the retina is made of rods and cones. When light hits the rods and cones, they send impulses to the brain to provide visual cues to identify how a person is oriented in relation to other objects. So for example, if you're walking in the middle of New York City and you're seeing this building, those buildings will appear vertical. So the second sensory system, your somatosensory system, these are receptors in your joints and muscles, and they're receiving information about where your body is in space. And it relies on three different strategies on level surfaces: your ankle strategy, hip strategy, and stepping strategy. So your ankle strategy, as for quiet standing, it's your first line of defense. It helps maintain balance by receiving information through the calf muscles. And small perturbations can be counteracted by our ankle strategy. Our ankle joints are designed to move in different directions, so it makes it a very effective tool to keep us upright. For more moderate perturbations, your hip strategy is your next line of defense. So if our ankle strategy fails to keep us upright, fails to keep our center of mass over our base of support, then our hip strategy will compensate. So you can see in this person, the hip starts to sway back, still maintaining that center of mass over the base of support to keep that person balanced. Hips also can move in all directions, so can help be effective in keeping our balance, but it's not as good as the ankle strategy. Our last line of defense, if our ankle and hip strategy fails, our stepping strategy. So utilized for large perturbations. So you see this person had to take a step forward to maintain their balance and not fall. It's effective, but it's not efficient. If this is your primary strategy for balance, then we have some work to do. So I want to put all of this together. So I would like to ask for one volunteer from the audience to help me out. Who would like to volunteer? Don't all jump at once. Okay, come on up, Sally. All right, so I'm going to be the patient and you're going to be the tester. So my back is going to face towards you. All right, so I want you to lightly nudge me from behind. Push me forward a little bit there. So yep, that's good. So you see I've leaned forward, but I was really trying to use my ankles to stay balanced. My calf muscles, even my heels lifted up a little bit, but I was still maintaining my balance using my ankles. Push me a little harder, a little harder. Okay, so I had to throw my hips now because she pushed me pretty hard there. So by pushing my hips back like that, I'm maintaining my center of mass over my base of support where my feet are. Okay, go ahead and really push me forward. Okay.
You're really strong. Thank you. Now you can have a seat. So she sent me flying forward, but I was able to catch myself because I had to really bring my foot forward, and now my base of support is much wider to keep myself upright and not fall. So that's your 3 strategies on level surface, okay?
And so our third sensory system is our vestibular system, where we'll be seeing this being used for uneven surfaces. So the vestibular system provides sensory information about motion, equilibrium, spatial orientation, rotation, linear movement. It generates compensatory responses to head motion via reflexes. We have our vestibulospinal reflex. Those are postural responses to keep our body upright and prevent falls when the body's unexpectedly knocked off balance. We have our vestibulo-ocular reflex, or VOR. Those are ocular motor responses that allows the eyes to remain steadily focused while the head is in motion. And we have our vestibulo-colic reflex, or VCR. Those are visceral responses to help keep the head and neck centered, steady and upright on our shoulders. So the vestibular apparatus includes our utricle and saccule that helps detect gravity and linear movement. The utricle senses motion in the horizontal plane, so that's forward and back, or left and right, or some combination of that. And the saccule senses motions in the sagittal plane, so more up and down movement. And the semicircle canals, they detect rotational movement. So just to show you where it's located, so you have your ear, there's your eardrum in the middle ear, and then in your inner ear is the vestibular system. And to blow that picture up even more, just to show you where these parts are located. So this is your utricle right here, and your saccule, and you have 3 semicircle canals. Your superior semicircle canal, your horizontal semicircle canal, and your posterior semicircle canal. Basically, what those canals have are fluid called endolift, and so when the head rotates in a direction sensed by a particular canal, that fluid lags behind because of inertia, and that exerts pressure along the canal's sensory receptor, and that receptor sends the impulses to the brain, tell the brain about that particular movement. When the vestibular organs on both sides of the ears function properly, they send symmetrical impulses to the brain. So normal response pattern. Under stable surfaces or level surfaces, you can see the percentages of the sensory information is being gathered. So 70% of that information comes from your somatosensory, 20% your vestibular, and then 10% visual. So meaning on level surfaces, you shouldn't have to over-rely so much on your eyes on where you are in space. You should be able to get that information, again, from those joint receptors in your muscles. Now, under unstable surface conditions, those percentages will change. And you can see that it's 60% from your vestibular, 30% from your visual, and then 10% from your somatosensory. So on uneven surfaces like grass or hills, those actually put your somatosensory system at a disadvantage. So you have to rely more on your vestibular or visual balance systems just to stay upright. The reason for that order going back to stable surface, the reason for that order there is because the somatosensory system is the fastest of all the sensory systems. It's also most sensitive to balance disturbances. The vestibular system is also fast, but is not as sensitive as the somatosensory system. And the visual system is actually quite slow. It works best when given vertical cues or stable visual conditions. So to recap of all of that, your three sensory systems, they provide input about your relative position of your body in space and your surrounding environment. That sends that information to central processing, where that information is interpreted, and then it's sent out or as output to the motor systems. And you have your motor systems, your neuromuscular system and your musculoskeletal system are involved in carrying out that information to provide stable movement. So your neuromuscular system is involved with coordination of your movement. You can see in this picture here, if this person's holding a very light ball, like a plastic child's ball, weighs less than a pound, that information is sensed going through your spinal cord to your brain. Your brain processes that information, sends that information back down through the spinal cord to the bicep to let it know that it doesn't have to be activated as hard to hold that light ball. Now, if that person was holding a 15-pound bowling ball, that information gets again sent back to the brain. The brain sends that information back down to the muscle to activate and contract more to hold that 15-pound ball. And then your musculoskeletal system, that's where your strength and flexibility is important in carrying out all your body movements. And so cognition is also important for balance. Cognitive function refers to how we receive and understand knowledge, memory, thinking, concentration, learning, problem solving, and perception of how things are seen in the environment. So with cognition, you should be able to filter out distractions while maintaining your balance. So walking through a busy street in New York, you should be able to filter out all the chatter, the honking of cars, just so that you're able to cross the street. And it's also important cognition is also important for multitasking. So, for example, you're in your home, you're walking from your kitchen, which may be a tile floor, then you're going to go into your living room, which is carpeted, while holding your cup of coffee, going to your chair, but before you go to your chair, your dog starts jumping on your leg. So you're trying to maintain your balance through all those different changes of environment. So going on to talking about age-related changes, so for the sensory component, where you have decreased visual, vestibular, somatosensory, and auditory function, that can lead to decreased body awareness and input about where the body is in space. And then you would have decreased ability to adapt to those responses. So such as using your feet to adapt on uneven surfaces, from going from a flat sidewalk to the grass. Age-related changes to motor components could result in decreased magnitude of muscle response. With the muscles being weaker, they may not generate enough power to, for example, standing up from a chair. Also, with weakness, you could also be using your arms more. So instead of using your legs more to stand up from a chair, you're really pushing up from the armrest to stand up. Or if you're walking with a walker, instead of using that walker for balance, you're really pressing down on that walker with your arms and trying to maintain your balance that way, which puts more stress on your arms and shoulders than need be. Age-related changes to cognitive function, so you would have decreased overall attention capacity and decreased ability to multitask. Some abnormal balance patterns you may see, for example, from a stroke, you may see this synergistic pattern where the group of muscles work together in a stuck pattern. There may be change in muscle tone or cognition, or they're more impulsive. Also impaired body awareness. So, for example, if someone suffered a stroke on the right side of the brain, they may have some weakness on the left side, on the left arm and left leg, but also may have some left side neglect. They may not be aware of their left side as well, and will tend more to sense more towards the center or towards the right side. With Parkinson's disease, that's a disorder that affects the dopamine-producing neurons in the brain. So the result is this dynamic gait problem where they have difficulty initiating gait, where they start shuffling or have moments of freezing, may show some tremors. They may also have this forward trunk flexion as well, this forward posture here. Some may have also experienced this BPPV, benign paroxysmal positional vertigo. This is a mechanical problem in the inner ear where the calcium carbonate crystals that are normally in the utricle, they become dislodged and migrate down to one of the semicircle canals where they're not supposed to be. And when that happens, that provides a false sense of rotational movement, which we call vertigo. So that's that sensation where the room is spinning, where it feels like it's spinning. So again, with this anatomy picture, this is the utricle where those crystals, calcium crystals, are supposed to be, but may be dislodged in one of the canals. Sometimes, or primarily, they may be dislodged in this posterior semicircle canal, which causes that dizziness and vertigo sensation. You may see some abnormal balance changes after a hip or knee replacement. So your range of motion is impaired, which alters your center of mass, and also an altered body awareness because of the new body part. This is just a list of balance tests that if you were to come in for an evaluation for physical therapy to work on balance, these are some of the tests that we would run on you, looking at your gait pattern, and different tasks such as standing with your feet close together, staying with your eyes closed, reaching forward outside your base of support, stepping over an object or tapping an object with your feet, standing on one leg. Different tests that we can go through to see where your deficits are in terms of balance. We also have the NeuroCom Balance Manager. Now this machine provides more objective data on which sensory system you have more deficits in, so that we can focus on working on that sensory system. The Balance Manager from NeuroCom utilizes Computerized Dynamic Posturography, or CDP. That's actually had initial support from NASA to evaluate the effects of space flight on the vestibular function and balance control in astronauts. So that's why this gentleman looks like he's about to jump off an airplane in this harness here. So during the CDP testing, the patient stands on a movable force plate with a movable surrounding. So the support surface here can move either forward or backwards, or it can tilt up and down. And then the walls here can also tilt and move. So there's 3 tests that I like to primarily use to help identify areas of deficits: the sensory organization test, motor control test, and adaptation test. sensory organization test, or SOT, again, looks at your somatosensory, visual, and vestibular balance systems. So to pretty much eliminate spontaneous sway, the floor or the walls may move in response to your sway. So I'm actually not controlling the movement of the walls or the floor, but the walls and the floors are moving into a one-to-one ratio to your sway. So the more you sway, the more those objects will move. This is just an example of a report that I'm looking at. You can see gray boxes, green bars, and red bars. So the gray boxes refers to normative values within people of the same height and age group. So if you score green, that means you scored above the normative values. If it's red, that's below normative values. For the NeuroCom, the published normative data goes up to age 79. The reason there's no quote-unquote normative value for 80-year-olds or above 80-year-olds is because it's just difficult to get a population of that age group with no symptoms or disease or history of disequilibrium. So yes, I have put some 80-year-olds and 90-year-olds on this machine, and I use that as like a baseline and then retest later after doing treatment to see if you improve. Basically down here will show me individual scores for your somatosensory, visual, and vestibular systems. This score will tell me if you over-rely on the use of your eyes for balance. This graph just tells me the appropriate usage of your ankle and hip strategy and how properly are you aligned in midline. The motor control test, that provides translations either forward or backwards, either in small, medium, or large perturbations, so that to kind of simulate you walking on a slippery surface like a puddle of water or ice, and to see how your muscles are reacting and keeping yourself upright. So what I'm looking here is the speed. What is recorded as normal value is 160 milliseconds. Should be how fast you should be able to react to these translations and stay upright. So if this person scored 186, that's too slow. So we're looking at the latency or speed in which if you're able to stay upright. With the adaptation test, we're looking to see how the patient minimizes their sway and regain their balance when there's irregularities or unexpected changes in the support surface. So that support surface may point your toes down or up, again, to kind of simulate more of uneven surfaces such as walking on hills or grass. Again, that's just an example of how the force plate can tilt. And I'm just, again, looking at the energy exerted of how you keep yourself upright. There's 5 trials. The first trial is just a baseline, doesn't count, but then the last 4 is what we're looking at. And with treatment of balance, so there's stretching and strengthening as important. There's also classes that you can participate, like the balance and stretch class with Talina or Tai Chi class. But if there's specific deficits that you're not sure of or would like to be more investigated, we can look at that through the balance test, either through the NeuroCom or the traditional physical therapy tests. And with those results from the tests, we will look at those deficits and base our treatments off those deficits. So these are some examples of strengthening exercises that you can do. You can sit in the chair, do leg kicks or leg raises, standing up, you can do leg curls or side kicks, toe raises, heel raises. For balance, you can do knee bends, you can do walking backwards, do a figure 8, side stepping, and this person is putting one foot in front of the other, doing in tandem, either tandem stance or tandem walking. So to summarize what I've talked about, in order to maintain your balance, you have to keep your center of mass over your base of support, whether that's with or without a walking device. Balance control comes from complex systems, multi-systems, from the sensory input and processing with cognition and motor output. And it's important to participate in those in an exercise program. So that's all I have for today. Is there any questions? No? Okay. All right, well, thank you for your time. Oh, I almost forgot.
If you're interested, members of the audience, if you're interested, what I can do is I can do a quick balance screen here and assess your balance if you're interested and see where you are, okay? If you're interested, have a seat down.